so stressed right now. Great. Hi, Sharon. How are you today?
Hi, how are you?
Good. My name's Lily, and I'm going to be your occupational therapist today. So I understand that you just got back from being in the hospital for a right hip fracture. So how's everything feeling for you?
Yeah, it still hurts.
It does.
Still hurts, yeah.
Okay. How has like moving around your house been for you, in balance wise?
We haven't really explored it too much, because of the pain. I've just kind of been laying low.
Laying low. Okay, great. Well, hopefully that's something that we can work on together. My role is, I'm here to work with you and just kind of get a sense for things that you want to do in the house and in the community, need to do or are expected to do. And then together, we're just going to kind of identify some areas where we can improve and build up some goals that you have for therapy so that we can get you back to living independently in your house and feeling really safe while doing that.
Oh, that would be great.
That sounds good?
Yeah, that sounds good.
Okay, great. So I guess I just have a quick question for you with regard to balance. How were you feeling prior to coming home with balance?
Oh, in the hospital, I was always assisted. So,
You were?
Yeah.
Okay. Okay. And then are you aware of your hip precautions? Did your physician go over those with you?
They did, but it was a lot of information at once.
Okay.
Yeah.
Okay, so yeah, just so we can go over that because we are going to get you seated up so that we can do a few assessments if you're okay with that.
Mm-hmm.
And then we're going to try to work on something that maybe could bring a little bit more to your life and everything. So just so we can go over these quickly, the three things that we're going to be focusing on is we don't want to bend up our hip. Okay. And then we also don't want to be crossing over our legs at all. Okay. And lastly, when you're laying here, this is perfect right now because your toes are just pointed up. And we don't want any rotation inwards. Okay. So one thing that we could do, and I think would be really beneficial for you, is we can provide a pillow to kind of keep your legs separated. Okay. And I think that that's just going to help you maintain the precautions better, and then you don't have to worry about it as much as you thinking about it all the time. All right. So I think what we can do first is we can get you seated to the edge of the bed, and then we can go through two assessments just to see kind of where we are. Does that sound okay? Yeah. All right. So I just, I'm kind of interested in seeing how you could do this for yourself. So if possible, and you have enough strength, can you prop yourself up onto your elbows in bed there? Perfect. Okay. And now what we're going to try to do is we're going to try to get your legs over this way. So if you can kind of move your legs in a clockwise position, and I'm going to help assist you with this. Yes, and you're just going to do that nice and slow, pushing yourself up. Perfect. And yes. And then we're just going to kind of try to weight shift a little bit to the front of the bed while maintaining more of a straight leg. And you can put your leg down if that feels most comfortable, just because we want you to feel stable there. So, so I think the first thing that we're going to try to assess is your balance, okay? So at first I'm just interested in terms of with you seated there. So how are you feeling?
Seated, I'm fine.
Okay, and it's helping the weight there a little bit with your arms?
Mm-hmm.
All right, so now I'm interested if you try to reach over to the side a little bit. Okay. Why don't you try to hit my hand over here? That feels a little bit?
Yeah.
A little bit off? Okay.
Yeah.
And then what about this side? Try to come over towards the right side to me.
Do you cross with this hand?
Yes.
Yeah.
Yes. Okay. All right. Perfect. Okay. That's good. Okay. And now we're going to try to do this standing. Okay. So again, you're going to use your hands and you're going to push up, but we want to be maintaining that precaution.
So you want me to stand up and then reach?
Well, yeah, I'm going to instruct you, but I'm going to just be here guarding you.
Okay.
Just if you feel any.
So just stand up for now.
Yes. That's just what I'm trying to get a sense for. Okay, so whenever you're ready.
Okay, can we do it at like the count of 3?
1, 2, and 3.
Okay.
How does that feel?
Yeah.
Not bad?
Not bad.
Okay. And then now, just again, why don't you just try to reach over to this side? Does that make you feel a little unstable?
Yeah, not so not feeling so good about that.
Okay. And then what about to this side? So a little unsteady, but that's okay. That is something that we can definitely work on. And I think another thing that's going to be really great for you is if we can get you a walker, because then once you stand up and you're trying to ambulate throughout your house, you're going to have something to kind of stabilize yourself. So you're not as reliant on just your own balance. All right.
Okay. Yeah.
All right. So why don't we also now have you kind of move your legs back a little bit, and then yes, maintaining that and just kind of guide yourself back down. Good. Awesome. Okay. So now the second thing that I'm going to test you, or that you just going to want to assess, due to, I know you have macular degeneration, and can you explain how that feels? Like do you notice any low vision issues or any vision impairments that kind of impact you on a daily basis, or no?
Yeah, things, are blurry at times, and there seems like there's things in the way.
Okay. Okay. So for macular degeneration, that's central vision loss, and I'm sure your physician has talked to you a little bit about that. But I just kind of want to get a sense, and I'm going to use the Snellen chart to get a better assessment for just like where the most vision loss is, so that we can kind of modify some of your tasks in order for you to just be a little bit more independent and feel like you have control over that.
Yeah.
All right. All right. So I'm going to hold up this, and can you read to me the third line down, please?
Yeah. P B G. That one's hard.
Okay.
And R.
Okay. Great. Thank you very much. Okay. So now, what I was thinking that we could do today, if this is something that's good, sounds good to you, is getting your socks on. Is that kind of a difficult thing for you to do?
Yeah.
Yeah.
Feet get cold.
Yeah. We don't want that. So, so kind of what I think what we're going to try to do with here is I have set up, and I kind of grab some of your socks, and I'm just going to sit here to provide a little bit of just comfort, supervision. But what I think we can utilize here is a sock donor, and what that's going to allow you to do is you're going to be able to take your sock, and then you're going to be able to put it over the sock donor, and then that allows you to then reach down with your arm and put it over your foot without having to bend here.
Oh, because it extends my reach.
Yes, exactly. So you don't have to bend down as much, and you're not as worried about the balance problems as well.
Okay.
All right.
Yeah.
So you want to try to do that? Okay, actually, one thing I'm going to actually have you do is, can you try to grab over there and try to use, instead of turning your head and looking directly at it, see if you can look through the periphery, so the outside of your, see if you're able to do that. Were you able to see that a little bit?
A little bit. Yeah. Okay. I mean, because it's nice, a bright color.
Okay. Well, the color contrast can really help too,
Yeah.
just in general.
Yeah. Right. Okay. So I'm going to put this thing over the top of that.
Mm-hmm.
Yeah. Okay.
Okay. And then what I'm going to ask you to do is just grab down.
Grab down.
And down towards your foot.
Okay.
Is that a little difficult for you?
Yeah.
Okay. So you know what? Here, you know what sometimes helps is what about if I do it with you, and then I'm going to kind of demonstrate it for you, and then you just watch what I do and just copy what I'm doing. Okay?
Yeah.
So here we have it. We're putting it over the sock donor. Okay.
Mm-hmm.
And then now we're going to lean down.
Okay.
Or we're going to not lean down. We're going to guide the sock donor down.
Okay.
Okay. And we're going to loop it over our foot. So
okay.
Why don't you try to do that?
Okay.
Great. Good job. How does that feel?
It doesn't feel so bad.
It doesn't feel so
Yeah,
bad?
I think I could get used to it.
Good. Okay. That's
Yeah.
wonderful. And how are you feeling balance-wise?
Well, with your hand there, but I don't feel so bad. I don't think I'm gonna fall over or anything.
Okay. One
Yeah.
other suggestion I have is that you could place your hand there, and then
Oh,
you have a little bit more balance on the side.
yeah,
Does that
that
make
feels better.
sense?
Yeah,
Good.
yeah,
Good.
yeah,
Okay. Well, how did that feel? That felt okay?
yeah.
Good.
Yeah.
Okay. Here, I can take that from you.
Okay.
So now we're just going to try to get you back um, into bed, so just so that you're stable. Okay.
All right.
And then I just wanted to quickly discuss two other things with you before I leave today, and then we can kind of make some plans for next time.
Sounds good.
All right.
Okay.
So again, we're going to just kind of do exactly what we did last time. We're going to try to shift you back into bed. Good. And just slow motions are great. Good job. Okay. Great. I'm going to guide you back down. There you are. Great job. All right. And then I just had two questions for you. When I walked in, I did notice that we have these medications, and I know you came home 2 days ago. Did you forget to take these, or was it just kind of an oversight because of everything going on?
Um, I was having trouble reading it,
Okay, that makes a lot of sense.
so just as a cautionary thing, I didn't take anything because I didn't want to like over or undertake what I was supposed to, or combine things when I shouldn't have. So.
Oh, okay. Well, no, that makes a lot of sense. And that can be something that can happen due to low vision. And there's some very easy ways that we can improve that so that you feel like you are able to see it a little bit better.
Okay.
One thing that's going to be very helpful is this task light and having that right near your bottles when you're reading them, because you're just going to be able to see it a lot better. And then another idea I have is that maybe what we can do is we can place labels that have bigger more letters, like so that you're able to read those a little bit better. And then maybe even we can set an alarm just as a reminder that throughout the day these are the different things that you're going to need to be taking.
Okay.
How does that sound?
That sounds good. Could you maybe put like the time on there that I take it?
Absolutely.
Okay.
Yeah, we can write it out on there. We can write it out on another piece of paper, whatever is best for you.
Okay.
And then my one other thing was just in terms of when you're trying to ambulate, and once we get you a walker, what we really want to do for your safety and just to make sure that we don't run into anything in your home is really clearing pathways in your home. Does that make sense? If you can't see it, it's going to be something that might be difficult to navigate around.
Yeah.
So maybe together next time, when I come before we start working on getting dressed further, maybe we can just kind of do a little assessment of your home, and anything that might be a fall risk, we can kind of talk through it and see if we can make any modifications or kind of pull things a little bit outside of your walking, just because I just want to make sure that you feel comfortable in your environment, and you know what I mean. So just because that will help you feel a little less fearful of falling, which is is a scary thing. And
I don't want to fall again. It was very unpleasant, and just the stay in the hospital, and and we're coming in on the winter months. It's just a lot to think about. Yeah,
I'm sure. Well, thank you so much for your great effort today. And I appreciate being here with you. So next time, we're going to just kind of continue to utilize the sock donor, and then maybe we can even transition into putting our shoes on and getting our pants on and everything. But over the course of the next week and before I see you again, it really helps. Just the more practice you get, the more it becomes just one to you. So utilizing that sock donor will be really great, and then you'll just feel a lot more independent in being able to do it for yourself.
So do you think there's some chance that I'll be able to return to going to church with my friends?
I really think getting the walker is going to really, really help you with that. And then also if we can, learn how to use our periphery a little bit more when walking and everything like that, I think that would be wonderful.
Okay, I really miss seeing them.
I'm sure you do.
Yeah.
All right. Thank you so much, Sharon. It was great seeing you today.
And one other thing, what should I call you? Miss Lily is okay?
Yes, that's great.
Okay, thank you,
All
Miss
right.
Lily.
Thank you so much. It was great seeing you.